What Dr. Jacome and myself have done over the last decade is really take a serious scientific approach to the treatment of obesity. And what I personally felt was very important is that, we would become a premier comprehensive weight loss center. What we always say is we're treating and curing the disease of obesity, a hormonal disease, and that really requires treatment on all levels, not just a surgical approach. So when I think about it, it's the treatment of obesity through behavioral modification, diet, exercise, psychologic treatment in some cases, and maybe the surgical, but also the non-surgical treatment approaches. So in our practice, we have a non-surgical weight loss program. We have, of course, our surgical weight loss program with the surgeons. We have our dietitian. We have a gym with exercise trainers and our psychologist, trying to encompass the whole person. And that's what, I think is unique compared to other practices.
When you see a lot of patients for excess weight, some physicians take the approach of like, okay, you're my patient, I want to do the surgery, make you lose the weight and we're done. But then you realize that the weight is a result of something else. A lot of the time it's just as simple as I love food, but a lot of the times had a lot of connotations or a lot of facts behind it that need to be uncovered and dealt with to have a long-term success. And once you go that path, it's just even more fascinating, the change that you can create in a person.
Additionally, we do all of the surgical procedures. We don't focus on just one procedure, and I think that's really important. Some programs may focus on one or two procedures, but we're doing all of the available surgical procedures: lap bands, sleeves, bypasses, duodenal switches, complicated revisions, endoscopic procedures. And it's just my philosophy. It's not a one-size-fits-all proposition.
The surgery that is performed depends on the patient needs and wants. So there are two things to take into account. What is that the patient want, and number two, whether it's medically possible or not. So the decision of what surgery the patient will have will be mainly guided by the patient, unless there is a medical reason why not to have the surgery, why to have a different one, then I will mention so. But otherwise, I let my patients choose what's best for them.
So when I get asked that question of what do I need to do to lose weight, I say it's simple, but it's hard. Simple in theory, but hard in practice. So I tell individuals if they're seriously thinking about changing their life to lose weight, they need to seriously start with a medical weight loss program first. We don't believe that surgery is something that an individual should just jump right into, but we know how difficult it is to lose weight for more traditional forms of treatment, such as medical weight loss, involving basically diet plans, exercise, and medications. So when somebody really feels like they've failed at the traditional approaches and their height to weight ratio, known as the body mass index, falls within an acceptable enough range to warrant the risks of surgery. There are risks to surgery, and that's certainly something we go over quite extensively in our program, but most of the time the risk of the disease, living with the disease of obesity and its inherent comorbid medical problems, is a greater risk than the surgical procedures themselves. So once an individual feels like they have exhausted all of the traditional means, then we would encourage them to come in and sit down and start that conversation. It's always a low pressure situation. We want to make sure our patients are fully educated and understand their treatment options prior to exercising the option of surgery.
The health benefits of having bariatric surgery are multiple. And I always tell the patients, in average, a patient that had bariatric surgery, their life increases by 10 to 15 years. But not only longer, healthier, because a lot of their comorbidities will disappear. Not only healthier, better and much better lifestyle. So it's not only about gaining number of years, it's gaining quality in those numbers. Taking into account specific diseases, 8 out of 10 people get diabetes cured overnight. If they have type 2 diabetes, they get bariatric surgery today. Overnight, you have 8 out of 10 cure. High blood pressure, 7 out of 10 cure. Sleep apnea, 7 out of 10 cure. High cholesterol, 6 out of 10 cure. Depending on what disease, what surgery you have, reflux, 7 out of 10 cure overnight. So bariatric surgery has a huge impact on your personal health.
So we have a quite extensive experience in obesity surgery. Our practice over the last 50 years has been probably perform well over 20 or 30,000 procedures. But here more recently in the last decade, we've performed over 5,000 surgeries, and every year we're performing somewhere in the 500 primary bariatric surgical procedures a year.